Sarah Mbatude is a vendor who sells face masks among other items. She says there has been a significant reduction in sales in recent weeks.
Tebikyatambula abantu bazibuddeko olw'ensonga nti bagamba nti COVID yaweddeyo atunda masiki baziwumule kuba tekyalimu ssente.
Mbatude used to sell more than 100 face masks a day when the country was registering a high number of cases. Currently, she sells only about 10 masks every day.
Era mbaguza 10 naye tebagula bagaza 5 ate ng'omuntu amaze kwevaamu nnyo ng'agenda kuyingira mu office.
For those that use public transport, putting on a mask in a taxi lately seems odd. According to the Ministry of Health data, there are only 2 COVID-19 patients admitted in health facilities. Apart from face masks, most other COVID-19 related products are currently experiencing a low demand.
We're getting roughly 180 to 230 orders per day. That is in the peak. Normally we get 90 to 120 orders. Okay, that is the rough estimate.
Rodney Bashabe, a clinical pharmacist at Rocket Health, says they had a peak in sales when COVID-19 cases were high and when learners were returning to school, as some schools listed COVID-19 related products as requirements.
From Jan to March, towards the end of March, where it is kind of now going down, we think the reason is because the children were allowed to go back to school. So a lot of parents were stocking up on these supplies, plus the fact that most of the schools were actually asking for them. So they were asking for sanitizer, they were asking for children masks, they were asking for vitamin C and zinc for their children, because at some point there was a sort of reinfection which was considered to be COVID, which we later learned wasn't really COVID.
The prices of some of these products have been reduced given the demand and supply factors, and also because of competition from the increased number of brands on the market.
Originally there were few, maybe 5, 10, okay, maybe like 5, 6. Right now there are like 20 brands on the market, and these new brands have come with a price change. So you may find, let's say it's KN95s, a different brand. We used to sell a box of KN95s at 95, we now sell it at 40,000.
According to Uganda Manufacturers Association, it is time to look at other options such as exporting these products and repurposing raw materials used to make some of these COVID-19 products.
We still have countries on the African continent that are importing many of these products from outside Africa. The opportunity here is that government can handwork our manufacturers into some of these markets.
Nobert Atukunda, NTV.